So, dear students, today's lecture is about bronchitis in children. So we will focus on definition of bronchitis, etiology, pathogenesis, and clinical groups of bronchitis in children. And also, we will stop on treatment tactics of bronchitis. Bronchitis, it is an inflammatory disease of bronchi, mucous membrane with a clinical presentation of cough, sputum production, dyspnea in case of small bronchial infection. Right? So, predisposing factors for being bronchitis, it is nose congestion due to narrowing of nose ways, anatomic disorders of nasal septum, focus of infection, upper respiratory tract, rhinitis, sinusitis, tonsillitis, immune response abnormality, immaturity of immune system in infants and toddlers in most cases, comorbidities, it is allergic rhinitis, sinusitis, laryngitis, and passive and early active smoking or toxicomania, carriage of provisional microflora in respiratory tract, and unfavorable weather. Humidity, high humidity, deviations of surrounding temperature, and etc. Etiologies. There are three main groups of etiology: infectious, non-infectious, and mixed etiology. Infectious factors are as well as non-infections. Viral, typical for predominant acute and recurrent forms of disease, 19% of conditions, more frequently influenza, parainfluenza, rhino-syncytial, adeno, rhino, corona, rota, enteroviruses. Bacterial bronchitis, Streptococcus pneumonia, viridans, Klebsiella pneumonia, Haemophilus influenza, Moraxella catarrhalis, Streptococcus aureus, Mycoplasma pneumonia, and Chlamydia pneumonia. Bronchitis pathogenesis, it is a mechanism of pathogenesis. We will describe this mechanism one by one. First, it is mucous membranes and prostaglandins, neutrophil microorganisms. First, second, pathologic microorganisms damage local tissue and stimulate releasing of prostaglandin and high histamine. It is first mechanism, and it can cause to edema, pain attack, and neutrophil and other effector cells. Second, it make microorganisms release toxins, stimulate neutrophils, permeability from circulation by diapedesis, penetrates through pores in a vessel's endothelium and direct towards affected site. Third, antibodies are special proteins that can attach to microorganisms. New neutrophils has receptors to recognize antibodies and pathogens, and they also attack complexes. Fourth mechanism, it's neutrophil create pseudopodias and absorb pathogens by structures. This digestion of microbes is performed by enzyme phagolysosomes or phagocytosis is performed. Fifth, last stage, its microorganisms are destroyed. Remnants of pathogens can be excreted on cell membrane. Change of bronchi in bronchus by normal and by during bronchitis. Bronchitis diagnose, all clinical symptoms can be divided for main constant and additional constant. Main, it is cough, production of sputum. Additional, it's rales, obstructive syndrome, and dyspnea. Cough is a guard dog of bronchi, yeah? Complex reflectory mechanisms that protects respiratory tract and remove foreign bodies or pathologic material, excess of sputum from bronchi, and maintain bronchial patency. An inflammatory process in respiratory tract impairs mucociliary clearance due to partial losing of ciliary epithelium in bronchi, impairment of secret moving, secret layer increasing, rising secretive viscosity, secret accumulation in various parts of the respiratory tract. Clinical groups of bronchitis in children. by pathogenesis, primary, and secondary by etiology, infectious, virus, bacterial, mixed, fungi, non-infectious, allergic, chemical, physical, smoke, or mixed due to infections or non-infectious factors. Cause, acute, lingering 2-3 weeks, lingering more than 3 weeks, and up to 1 month, recurrent, repeat more than 3 times per year. Clinic type, simple maybe or obstructive. Affected level, tracheitis, tracheobronchitis, bronchitis, or bronchiolitis. Tracheitis, it's a mucous membrane inflammation as a result of acute respiratory disease of viral etiology. Disease can be accompanied by inflammation of larynx, laryngotracheitis, or tracheobronchitis. Acute simple bronchitis. Mucous membrane inflammation predominantly is caused by viral infections, symptoms of viral intoxication, common condition, impairment, chills, decreased appetite, behavioral change and of child flaccidity, weakness or excitability, impairment of sleeping, fever, and headache, age, transient muscle pain, catarrhal events, and nasopharynx. Symptoms of bronchitis, cough, sputum production, formation of rales, dyspnea. Physical examination, percussion and palpitation without chance, auscultative, rough bronchial sound, prolonged expiration, bilateral rales in various parts of lungs, chance after cough. Hemogram chance elevated ECR while normal or decreased leukocyte count. Chest X-ray enhancing or bronchial linearity, root shadows is wide, not clear. Obstructive bronchitis. Diagnostic criteria, it is obstructive disease with a bronchial obstructive syndrome due to inflammatory decreasing of bronchial aperture. Diagnostic, some criteria is common condition, impairment, rhinitis symptoms, nasopharyngitis, catarrhal symptoms, body temperature normal, sometimes subfebrile, rarely hyperthermia, manifested respiratory failure, signs of bronchial patency abnormality during percussion tympanic sound, auscultation road bronchial sound, prolonged expiratory sound, moist bubbling rales, during expiration, dry whistling rales, manifested tachycardia, X-ray picture, intensification of vascular picture, increased clearance of lungs due to emphysema, amplification of bronchial picture. Factors of bronchial asthma development. It's recurrent obstruction, atopic inheritance. Obstruction is initiated by a contact with allergens of non-infectious nature, provided dust, epidermal or types of sensibilization, comorbidities, and other allergic disease like atopic dermatitis, allergic rhinitis, conjunctivitis, and IgE level must be more than 100 international unit. Bronchoscopic picture in obstructive bronchitis in aperture of the left main bronch, solid sputum clot is visible. Yeah. Bronchiolitis, acute generalized obstructive disease of distal respiratory tract terminal bronchi. Disease develops only infants. Clinical peculiarities of bronchitis, progressive dyspnea, non-productive cough, manifest symptoms of severe broncho-obstructive syndrome, signs of respiratory failure, and other organs and systems reactions, percussion, tympanic resonance, auscultation, bilateral, manifest respiratory sound, attention, respiratory sound isn't audible. It in basal part of lung crepitation or babbling sound on the ground of attenuated breathing sound, spatial, inspiratory, PEEP is audible. Chronic bronchitis disease, it's characterized by the episodic or constant cough and sputum production for 2 or more years. Summary duration of productive cough is more than 3 months per year. Diagnostic criteria of chronic bronchitis in children: prolonged pulmonic anamnesis, stable clinic signs, impaired tolerance of physical loadings, change, shape, or deformities of chest, thickening of distal phalanx and nasals. Stable physical change in lungs, radiologic signs, solidified X-ray picture with emphysema signs, pneumofibrosis, manifested deformity of lung picture, deformity of bronchi, stable, sometimes progressive respiratory function impairment. Bronchitis treatment. Severe course of big bacterial bronchitis, complicated bronchitis with manifested mucus retention, bronchiolitis in children less than 1 year old because of threatening of emergency conditions, severe types of obstructive bronchitis, lingering and recurrent bronchitis, chronic forms of bronchitis, and bronchitis on the ground of another somatic disease, and social reasons. It was all indications for hospitalization with patients with bronchitis. Treatment regimen, special regimen, it's not necessary, but more proper home regimen for all acute period. Diet must be rational with rich vitamins, medications, etiologic and pathogenic treatment. Indications for antiviral medication in moderate and severe course of viral infection, accompanied by bronchitis. In children with respiratory support for bronchitis prevention in a group of frequently and severe ill children, for prophylaxis and treatment of premature children, in complex treatment of recurrent bronchitis, for prophylaxis of chronic bronchitis exacerbations. Etiologic bronchitis treatment, antiviral treatment, rimantadine, Algram, Arbidol, Amixin, Tamiflu, Aflubin. Antiviral treatment, interferons, human leukocyte interferon, reaferon, viferon, griferon. Indicators of interferon, inductors of interferons, cycloferon, neovir, poludan. Etiologic bronchitis treatment, antibacterial treatment, indications for prescribing antibacterial treatment. Fever more than temperature 38 Celsius for more than 2-3 days, especially in infants, intoxication signs, pleural sputum production together with intoxication, presence of chronic locus infection together with bronchitis, lingering more than 2 weeks or recurrent course of disease, premature of children or infants or first 6 months old with low indexes of health, and favorable premorbid form with disease, chronic bronchitis exacerbation with clinic indexes of the bacterial infection, and hospital bronchitis. And biotic treatment approach, choose of start antibiotic, choose of proper medication delivery, oral or intravenous or way. Choice of effective antibiotic is performed empirically, taking into account more probable causative factor according to the site of infection. Medications of choice: aminopenicillin, cephalosporins, first and third generation macrolides. Principles of treatment: respiratory tract mucous membrane inflammation suppression, normalization of secretory apertures and mucociliary transport functioning, control of cough reflex, restoration of bronchial patency. Anti-inflammatory tract treatment. So its effects ERASPAL. ERASPAL, it's perform multiple function on inflammation. Action is similar to corticosteroids, but without side effects, and typical steroid therapy. Its influence of vessels and cell components with inflammations that decrease permeability of vessel and exudation and edema. Partial blockage of alpha-adrenal receptors, influence of bronchial patency due to spasmodic action, antagonist of activity, H1 histamine receptors, decreasing of leukocyte infiltration, and non-direct influence for cough intensity. All medications that influence the disease process can be divided into 6 main groups: mucokinetics or expectorants, respiratory tract secret rehydrant medications, mucolytics, mucoregulators, medications that stimulate lung surfactant production, and antipertussis medication. Mucokinetics, expectorants, secret motor medications, mucaltin, bronchium, and tussin. Resorptive medications, respiratory tract secret deodorants, 1-3% of water solutions of sodium and potassium iodines, so 0.5 to 2.5% ammonium chloride water solution, 1-2% sodium hydrocarbonates water solution per oz or for inhalation. Secretolytics, medications that regulate secretological properties, change biochemical mucus composition or production, non-direct activity, yes. Change adhesive properties of gel layer, influence on zole layer and rehydration, violate substance and balsams. Secretolytic stools, enzymes, and others. It's cysteine, anti-acetylcysteine, fibronin, mycin, enzymes trypsin and beta-chymotrypsin. Medications that regulate secret production, it's rheologic properties, Fluidotec, Fluidicort, Mucodin, Mucopront. So mucoactive medication, ambroxol, ambrosal, lazalvan, ambran, holiscol, and bisolvan. Mucative medications, pharmacological properties, mucoregulation, mucolytic, mucosecremotor effect, elimination connected with the increased mucus fluidity and its expectoration, metabolic activation of alveolar surfactant, anti-inflammative and immunomodulative action, lung protection of oxidative stress and decreasing of bronchial hyperactivity, partial suppression of the cough reflex. So we have antipertussis medications of peripheral action, labixin, tusiprex, levofront, and central action, narcotic medications, codeine, dionine, and non-narcotic medication, Cinicor, Galavant, tusiprex, sedatucin. Bronchitis prophylaxis. It is organism tampering, vaccination against acute respiratory disease, infectious focus eradication, and sanatorium treatment. So there's, for today, it's all. That's all. Thank you for your attention. Be healthy.